For me, it's personal because when I got out of the military, I actually got out with quite a bit of an injury myself. And so with a spinal injury, that leaves me in a lot of pain for majority of my life and my wake hours. And so for me, one of the thought processes I went through early in the day was, if my pain and the condition that I left the military with and the injury escalated, and I became so incapacitated, I needed this kind of support around me, what kind of support will I like to get? How would I like that care to be delivered to me? Do I want to be going 10 different places to get my healthcare delivered each week? Or do I want to just go to the one place and they know me really well and they can deliver that healthcare really well? And certainly the latter was my preference. When I looked around, the latter is a preference for most people. So why not really go down that path and do it well? And that really explains why for me, it's never been about earning from doing this. It's always been about creating such a legacy service that delivers healthcare care so well that I will want to have my healthcare delivered that way. And so I thought, well, why isn't there a solution here of where a person just needed to go to the one place, a one-stop shop health solution that will provide their medical needs through their general practitioner, their allied health or therapeutic needs, as well as their direct care needs. But even better, what happens if these three areas really talked? They were really working together and they really knew their client or the patient or the participant, whatever you might call them. What happens if they knew them really well and they were discussed through clinical meetings? How can we actually assist this person to get the life goals they're looking for or to have a better quality of life? And what I discovered through the process of forming this with Neta Care was that realistically and genuinely, if those things were working in a really tight collaboration, the quality of life and the ability to achieve health goals or life goals for a person with a lifelong disability is so much more achievable. Do we get to the end result at a much quicker pace, which means that people with lifelong disabilities don't have to spend a lot of time driving around from one person to the other and re-explaining themselves of what do they need and how do they want to make things work. And that's really where it was birthed from. Well, initially I was told there's a reason it's not done. There's a reason that people don't go to one place to get everything done because it's just too difficult to coordinate that. And I thought, well, why not? Because the hospital does it. The hospital is a one-stop shop health solution. The hospital has the doctors there, the nurses, care workers, the therapeutic services. It's all under the one roof. Why don't we bring that model and essentially do the same thing? And I was told it's an expensive endeavor, which is why most hospitals are owned and run by government. And so I thought, okay, well, challenge accepted. Let's see if we can make it happen. Back to the journey. And what they said was true. It was a very complex system to put together. And especially for a person that came from an engineering background, putting together a clinically capable practice of multidisciplinary teams was challenging, but we kept working at it, and bit by bit, we got there.